Thank you so much, everyone, for joining, and what a lovely event this is. I just am so appreciative to everyone who put effort into designing this and for you all for attending. So my name is Hannah Diamond. I use she, her pronouns. I'm from Justice and Aging, and we also have Candace Robinson from Capital Impact Partners here. And we're going to be talking to you about opportunities to really be innovative with New Jersey's HCBS infrastructure. So we're going to be talking about the work of our two organizations and kind of what our work is going to look like ongoing in the state. And then hopefully we'll have time to really hear from you all. We want to make this be a dialogue and identify opportunities to collaborate moving forward. So again, thank you for being with us. Okay. Is this advancing? Okay, so again, Hannah Diamond, I'm a policy advocate and I use she, her pronouns. So my organization is called Justice and Aging. We've been around for about 50 years. We use the power of law to fight senior poverty, and we do this in a triple-pronged way. We do litigation, we do advocacy at the state and federal levels, and we also have a contract with the federal government to run something called NCLR, which is the National Center for Law and Elder Rights. This is basically a wonderful resource where we provide trainings for advocates across the country on issues relating to older adults. So everything from Medicare to Medicaid to SSI to equity. There's going to be some contact information for us at the end of my slides, but if you are not familiar with NCLR or Justice and Aging, I really encourage you to check us out. We are very focused on equity, both internally and externally. And so our work really focuses on those who have been historically excluded from justice. So this is older women, people of color, LGBTQ+ individuals, and older adults with limited English proficiency. And so I mentioned the equity part of our work, both internally and externally. So with funding from the Henry and Marilyn Taub Foundation, over the last year, we spent a significant amount of time reaching out to stakeholders in New Jersey, many of whom are probably on this little breakout room today, talking about opportunities to really be innovative in the state and advance kind of the aging experience for older adults. And we produced a report that is included in these slides and was included in the materials that basically provides opportunities for us in a range of areas to advance equity and advance the HCBS infrastructure. So I'm going to highlight a little bit of the findings from that report, and then I'm also going to highlight what the next year of our work is going to look like in the state so that we can identify opportunities to collaborate. So I want to first tell you about why we're excited about New Jersey and why we are really being intentional about working here. I mentioned that we work at the federal and state levels. We work very extensively in California, and I think New Jersey is really our next opportunity to be innovative. And I just want to highlight why we as advocates are excited. First of all, deeply ingrained into Medicaid law. So Medicaid is low-income insurance, and it is the primary funding mechanism for long-term care services and supports. So entrenched in federal Medicaid law is an institutional bias. States are required to provide nursing home care, but they are not provided to offer home and community-based services. And as a result, we see an institutional bias across the United States. And New Jersey has opportunities to improve upon expanding home and community-based services. This has been something that came up very publicly. New Jersey was publicly shamed during the pandemic with everything that happened in nursing homes and the Manat report. If you look at the spending ratios for home and community-based services versus institutionalized care, there are 34 states that spend more money proportionally on home and community-based services than New Jersey. So there's really opportunities to improve. But as a result of what happened during COVID and the public attention, there's been a lot of progress in this space. And I'm gonna highlight that in a little bit and really highlight why we are so excited to be doing this work. I want to tell you about who the individuals are that I'm talking about. I'm talking about 217,000 low-income older adults who are dually eligible. So dually eligible means that someone is receiving both Medicare and Medicaid services. And duals, because they have been historically excluded from opportunities due to systemic discrimination, are more vulnerable and also more diverse. So you can see in comparison to Medicare-only recipients, duals are much more diverse, and therefore we need targeted strategies that really represent them and speak to their needs and their aging experience. So again, I highlighted and really want to say why we're so excited about New Jersey. We think that the policy environment is really ripe for change. So you have the state strategic plan on aging, you have the age-friendly movement, but you also have a really innovative 1115 waiver. This is an experimental demonstration-based waiver that the state is using to provide its Medicaid services. And we see a lot of opportunity for innovation in this space. And then also New Jersey took advantage of American Rescue Plan Act funds to grow its home and community-based services infrastructure, which we also really think is an exciting policy lever. So again, we produced a report that was released in June. If you haven't already seen that report, I encourage you to review it. I'm just going to give very high-level findings from the report due to our time restraints today. But if you are a coalition, if you are working in this space, please reach out to me. I can present about the report to your coalition, or I'd love to hear from you really like what resonates with you, what you're excited, what you as stakeholders want to see for New Jersey. So we produce recommendations in all of these areas. So when we're thinking about equity and when we're thinking about expanding home and community-based services, we need to be thinking about what types of data are we collecting and really making sure that we're looking about disparities in access and utilization. Are these services readily available, and do people know about these services, and are they accessible for the various Medicaid recipients? So how many languages are they offered in? Are they just offered on the computer? So we need to really be thinking about who our recipients are. And then also we noticed when we did an analysis of the various pathways to become eligible for Medicaid services, that because there are so many different pathways, there are opportunities for inequities in access. So this is both in terms of the financial determination piece and the clinical determination piece. And then once someone accesses these services, what are the quality of the services that are delivered? So we have recommendations in each of these areas. We have particular areas that we are really interested in, but really this is kind of where I turn it to you. If we have time, I would love to hear kind of what your interests are, what your priorities are related to an HCBS infrastructure. The next year of our work in New Jersey is really disseminating this information, hearing from stakeholders about what their priorities are, and then us really providing support. So we have technical expertise in these areas. We are available to attend a meeting with a department official, with a member of the legislature, testify at a hearing, and also produce materials that can support and move those issues forward, like an issue brief or a fact sheet. And with that, I just want to make sure that you have our contact information. I will put my email in the chat, but if you are not already a member of our network, please, please, please join. We have incredible information that we're sending out all the time about everything related to HCBS and aging really at the federal and state levels. And this is a great resource. And then my contact information. So with that, I'm going to turn it over to Candace, and thank you all so much for being here and for your time.
Thanks, Hannah, so much. And I know we're short on time, so I'll give you the 5-second, if I can, overview about who we are. So my name is Candace Robinson. I serve as the Director of Healthy Communities for Momentous Capital. We are a family of companies. I've been with Capital Impact Partners for over 18 years. And just so you know who we are a community development financial institution. So we are interested as impact investors in providing both capacity and capital to build communities of opportunity, especially for those individuals who are low income or at risk of homelessness, and also across all of the social determinants of health. And so we've been involved in expanding and trying to support the systems development and built environment so that innovation models like the ones that Hannah talked about, an expansion of home and community-based services, can actually create more choice in our communities. We have been involved with affordable assisted living, gosh, for almost the 18 years that I've been with Capital Impact Partners. And one of the reasons why we came to New Jersey is that you have an innovative model. The assisted living model, this assisted living program model, is one that is already on the books. It's already in a regulation. It's kind of one of those things. And when you talk about innovative models, how do you convince the state to start a new model or to take a new model on? And we came into this state saying, you already have it. How do we foster it? How do we create it? And I think it is really starts to think about as we talk about innovation, as we talk about what are the pieces and parts that all need to work together within the system. So as Hannah said, you've got the home and community-based services Medicaid reimbursement, but it also requires regulatory environment across, it requires systems to be able to be talking to each other. It needs coordination across these silos that we talk about, from a state to a county to the local to even MCOs and also housing providers. And then also there's the silos. So that's something that we've been doing, and that's our focus here, is really that dot connection. How do we help you all create that environment? We've been involved in developing the Affordable Assisted Living Program Coalition. We were invited in with the Taub Foundation in 2018 to really look at the model and say, how can it grow? How could it be fostered? How can it be sustained in this community? And so that's the work that we've been doing. If you want to know more about the assisted living program, I would encourage you in the next, 15 minutes, you get to go to another table. It'll talk all just about that, and we can break that down for you. But I did put the Padlet up here. The coalition is growing, and I think one of the things that we've learned, we are also part of the PACE coalition that's also trying to grow the PACE model. We've been working with Permanent Supportive Housing and Corporation for Supportive Housing to expand kind of aging in permanent supportive housing. So it's really, for us, it's an asset-based approach model. And I think as advocates in the community, there are these models of how do you grow the engine at that local level to allow not only all these financing pieces are in place, but the regulatory structure, getting all the partners involved in educated in awareness. And so through your age-friendly work, as well as through the coalition like we've been working, that's the type of support that we see as far as how to expand this innovation. So I'll be quiet, but would make a 2-second interview, commercial for if you want to learn more about ALP, come to the next session, but we'll open up the floor because I know we're on limited time.
So I wonder if anyone has any questions for us or thoughts, or if you want to share your priorities related to the HCBS infrastructure in New Jersey. We would love to meet you and hear from you.
Hi, everyone. My name is Allison Perschke. I am the quality specialist for I Choose Home New Jersey. So your report has been very instrumental in, us thinking about all of the things that you've discussed. A lot of it is things that we had been discussing internally already. So I'm definitely going to be shooting you an email so we can connect. But for us, I think the equity piece is really important. And I have a lot of feelings about kind of the system at large and equity, but also community integration, which is something that we haven't been focusing on as much as we should. And I think the shift in general toward integrated care is really important, and we need to be on the forefront of that as well. So thank you for all that work you folks are doing. We are absolutely looking at that, taking into consideration and moving forward with it. So thank you for that.
Thank you, Allison, so much for sharing that, and would love to connect. Emily?
Yeah, thanks. I'm sorry I'm joining late here, but I wanted to ask, in your work in New Jersey, are you in direct conversation with people who have direct power and authority over Medicaid, like in terms of the relevant professionals within the state? Are you in conversation with them personally, or is it really through others or kind of through the public that you're targeting the recommendations that are really important?
Is that for Hannah or for me?
Both of you.
Okay. I mean, I can say for the coalition, a lot of the work that we've been doing is working directly one-on-one with the Department of Health, as also and also Jennifer Jacobs and her team at the Medicaid office, really explaining and understanding and really just educating folks about what the ALP model and what it does and how it works. We've also been able to, through the grant with the Taub Foundation, really finance some research on cost savings, kind of looking at the benefits. We engaged Rutgers University as well. So all of those details, like Hannah's, deep research and the work that we've been doing, I think really helps influence and have that conversation, because then it's factual, right? And then you're presenting that reality to the folks.
Emily, I really appreciate that question. With the way that our work is structured in New Jersey, we are really looking to partner with coalitions that already exist in the state that have those connections. And we are really there to provide you all with support. We're very mindful of who we are coming into this space, the fact that we are working extensively at the federal level, and like my office is based in Washington, D.C., for example, and also California. So we're very mindful of that. And you all, the stakeholders on the ground in the trenches, you all are the experts. And we're there kind of as like the policy wonks that can tell you about 1115 waivers and things like that. And we really want to empower